There are two types of chronic leukemia, myeloid and lymphocytic. Can you just describe the difference between them?
Chronic lymphocytic leukemia is the most common type of leukemia, so it's seen on average in around 5 or 6 cases per 100,000 population per year. So it's something that will be encountered not in every consultation, but certainly in primary care. I think all GPs will have patients with chronic lymphocytic leukemia. It's typically diagnosed in older patients. The average age of diagnosis is 72, and almost all cases it's diagnosed in an asymptomatic phase. 90% of CLL now is diagnosed with people who have blood tests done for other reasons. Go and see the GP for a sore throat, tiredness, something that may have nothing to do with their abnormalities. They have a blood count done, and then it's picked up, often in an indolent stage. Chronic myeloid leukemia is much less common, probably about 10 times less common than chronic lymphocytic leukemia, and so in terms of the frequency, it will be seen in primary care relatively less commonly. It's seen in all ages, can certainly be seen in younger patients, and again it's often picked up incidentally. The presentation can be quite insidious. Unlike chronic lymphocytic leukemia, it will often present with a very high white blood count, an enlarged spleen, and it's more often than not will require treatment at the point that the diagnosis is made because of the manifestations of the disease. But what they share in common is that they're both a proliferation of abnormal bone marrow cells where the kinetic of that growth is relatively slow.